Hello, this is Dr. Bob and Debbie DeMaria. Welcome once again to our Half Off Health program. And tonight we are just talking about basic information, life and death. I don't mean to poo-poo this, that it's just basic. This is life and death issues. You know, we talked in the first segment about subluxation. Subluxation is when a bone goes out of alignment and puts pressure on sensitive nerves. Guess when subluxation starts? It starts with the birth process. Were you a forceps baby? How do you know if you're a forceps baby or not? Well, you can ask your mom. If your mom's not around, you can look at your nose. Do you have a deviated septum? Chances are they put the clamps on your nose and literally broke your nose. Or do you have ridges on the back of your head? So that birth process, for some people, can be very traumatic. You might say, well, I was born with C-section. They did surgery to take me out of my mother's uterus. Well, C-sections are actually more traumatic to the spine than natural childbirth going down the birth canal, because when you go down the birth canal, the vagina is contracting, causing the muscles in the child's neck to be supported. So what was your delivery process like? You know, I'll have somebody come into my office and they'll say, Dr. Bob, I have been sick. When somebody says this to me, I've been sick my whole life, guess what? I know that they probably had a traumatic birth from the beginning of their life, or they started eating whole foods too early, or they were immunized.
Well, Dr. Bob, you know what is, I don't want to say the word scary, because that's not true, because we know that there is an answer to all this. But what causes ill effect in your life, which we're going to look at a few things right now, is that these things are not taken care of. And over time, gravity will push down on your spine, causing really, again, ill effect to your whole health system. You won't experience wellness. Now, here's something that you can do with the person that you're sitting next to, or have somebody check you if you're there by yourself next time you see them. And you check them, of course. Dr. Bob showed one. How many of you, you know, any time of year you could really analyze people going to sit somewhere in a park, in a mall, in a restaurant, and just see how other people are. Oftentimes people or yourself are sitting with your head totally off your body. You have to understand, in that position, what I'm doing right now has to be choking. All of those vertebrae are choking that spinal cord, and there's no messages getting down. So everything your body, all the symptoms your body is having, is really the effect of your posture. Well, then you have rounded shoulders. So maybe your head is actually sitting back on top of your body, but you're walking around like this. Then you actually can watch people or look at yourself right now, and the way you're sitting. Is your shoulders back? Are you holding your head erect? Can you even hold your head erect? These are signals to us that your posture, there's something going on. And if your posture's off, your spine is off. Dr. Bob, what would you like to add?
Well, Debbie, it's kind of interesting, because as you were doing this, I was cringing at all that. But we see that. We see individuals that are hunched over like this. But you know what else is going on with them, Deb? Their lungs are being compressed. When your lungs don't have vital capacity, that means they don't have enough oxygen, and oxygen is fuel to the fire in your body. We've had patients that have come in and said that their posture's improved and their energy's improved, because, see, your body's doing everything that it can to keep you erect. And if your body's in a constant state of this, your brain is trying to do everything, because, see, to go forward requires no energy at all. This requires enormous energy. When somebody makes that wise choice to come into our office to be checked and have a subluxation checkup, then we start to correct their subluxation. Not only do their sinuses improve, and breathing and digestion and all these other areas which you maybe have never even heard of before, because remember, your nervous system controls the function of your body. So if you're taking medications right now, and I don't have a license to take you off your medication, you always talk to your prescribing healthcare provider. But if you were really wise, you would go with this team approach with a natural wellness doctor. This is exactly what we do in our practice with your conventional medical doctor, and work together, improve your posture, change your diet. Because, you know, Deb, this is something I want to just allude to briefly. What you eat. So gravity, remember, gravity continually and relentlessly pushes down on top of you. But what you eat can cause a toxic subluxation. See, we have all these organs that are inside of your body. And if this one organ right here, let's say it's your pancreas, is being irritated because you're consuming too many chocolate bars, it's going to send a message back where it gets its electricity. So I know there's someone watching me right now that's probably eating a candy bar, Deb, and drinking a soda pop, and their left neck always hurts. That's because you have what we call a visceral organ, somatic muscle subluxation. So if you have chronic left neck and shoulder blade pain, I would minimize and eliminate bananas, raisins, and grapes. Bananas, raisins, and grapes, they're not bad food, but you're consuming too much sugar. If you're eating donuts and pastries and cookies and soda and sweet fruits, you can have visceral somatic subluxation. Very serious, Deb.
It is very serious. Dr. Bob, do you know that you can live without food? It's actually been 3 or 4 weeks that people could just drink water and eliminate food from their life. And if you've ever watched the television show Survivor, you see that they function without very little food. So we can do that. We can live without water, especially depends on the temperature out there, but we can probably live without water for about 7 days without giving our body any type of refreshment. We can actually live without air, sometimes up to a minute or 2, depending on what your lung capacity is. But you can't live, Dr. Bob, if your nerve is severed.
That's right.
It is instantaneous death. So we're actually slowly, by having subluxation, adding a negative to our life. We are taking life away from us. That's why in our office we're so successful. From the womb, we have people come from right from the hospital with their babies to the tomb. We have 90-year-olds coming in for chiropractic care. We see life restored.
Well, Debbie, it's so fascinating when you start to really get the big idea of what's going on. And that's the whole purpose of this program tonight, is to help educate you, because I know that you're sitting on a couch or sitting in a chair somewhere in the world right now. You're just scratching your head saying, I wish someone could just figure this out. And that woman I was telling you about the other day that she should come into our office to be checked, she was discouraged by her medical practitioner for coming to see us. 13 years she suffered. And I know, because you've seen so many guests that have been on our program before that just talk about the miracles of subluxation correction, their body starts to function optimally. You know, there's been so much research. Back in the late 1980s, there was a Dr. Perot that did studies on chiropractic patients, and he used them as their wellness model compared to people which were considered well, and that the chiropractic patients live longer. Their immune system is much stronger. We know that through research and doing blood tests on individuals that a white blood count will increase when you get a correct subluxation adjustment. I also know research has been done, it was released just a couple of years ago, that a chiropractic adjustment to this upper vertebra here in the spine, which is called the atlas. So your spinal, the lower part of your brain stem sets right up here. If your brainstem is getting choked, like I was telling you, well, they've done studies with a chiropractic adjustment where you correct this subluxation, and we use what we call a toggle correction. It's the way we do our spinal adjustment. You can lower one's blood pressure 17 points with a properly applied chiropractic adjustment. So I know that some of you may say, well, Dr. Bob, how can I check? You know, Debbie, we talked a little bit about off camera with the posture. And what you could do right now, we're trying to make this a little bit interactive with you. And if you have a mirror in your room where you're watching television right now, if you're watching this on a computer, you can do this after the program. What we usually have our patients do is close their eyes and take their head back and forth, left and right, and then we have them look straight ahead at me in the practice. So let's just say that their head is tilted like this. I'll know that their head is off to the right, their shoulders high on the left. And what's so amazing, and Debbie, you talk about this a lot, if your shoulders or your head's off and your shoulders high, that's what it's going to show on your x-ray. But Debbie has said in the past, it's just like people are so concerned about their smiles, they'll spend thousands of dollars to get their teeth straightened, but they don't think anything about their spine. And your spine is so much more important than your teeth, because if your spine is not functioning optimally, your brain is not able to send those vital messages down. It's really intense, isn't it?
It really is intense, Dr. Bob. And I do want you to know that you have to do that very quickly when you're testing yourself, because really your body actually tries to move to a proper position so it looks like you're straight. That's why you want to keep your eyes closed and quickly look in the mirror. You'll get a correct spinal look.
One last thought before we do our close. What happens is, if you got traumatized like this, watch me, your body will do that. It'll do whatever it can for compensation. You know, you could be watching us anywhere in the world right now, and you have been suffering with chronic health problems and don't know what to do. Well, we broadcast live in our office every Wednesday at 12 Eastern Time. It's a program called The Half Hour of Health. You can log on and participate with us. It's interactive. You can type questions, but you can watch us live, and we're there to make a difference inside of your body. You could also come into the office. You know, we have patients that come to see us from all over the world. If you've been suffering with chronic challenges, why don't you call the office? You know, we normally charge anywhere from $165 to $200 for an exam and an x-ray. We'll make that available to you today for only $25. What a great opportunity. We'll do an assessment. We'll sit down and we'll talk to you. We'll take your blood pressure. We'll look at your posture. We'll take films of your spine to determine the exact level of subluxation, and we will apply the correct adjustments to help improve your function over time. It's all about time. It's not going to go away overnight. Remember that gravity continually and relentlessly pushes down on top of you. If you're tired of taking medications, why don't you talk to your healthcare provider? Talk to us. Let's create a strategy to help. See, we're into wellness. We're not into sickness. If we can help you get well, you're going to stay well. You're going to save time, money, and energy. You're going to be a pleasure to be around. You're not going to have fatigue. You're not going to have pain. Get on the fall. Give us a call today. You'll be glad you did.